I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. So we're now getting into a series on gender-affirming surgeries, the surgeries themselves. And we're going to start by looking at FFS, or facial feminizing surgeries. So a few basics to begin with. We're going to look at both feminizing and masculinizing surgeries in this next section of content. Now, this information cannot be construed as medical advice for any individual, but it's just more information for you to think about as you learn about these surgeries. We can't assume that one technique or one way is better than another, but different surgeons will have different approaches, and they tend to use those approaches that work best for them and their patients. But people get very opinionated about this stuff, and so you're going to hear some people who say that this is the one and only way to do something. Well, in my opinion, that's not quite accurate. So let's take a look at this. What is facial feminization surgery, or FFS? FFS is actually a collection of surgeries, and these can be done in stages or all at one time. What they do in this surgery is to look at the features of the face that scream male from across the room, and they modify these features to make a person appear more female. So let's start by looking at the facial bones of people who were assigned male at birth and people who were assigned female at birth. So this is from Dr. Osterhout's collection. You can see the male skull at the left and the female skull at the right. These are two different bodies, of course. But you can see that there are some very prominent features on the male side that would distinguish this face as being male. For example, this skull has a very prominent brow bone. Notice how prominent the upper part of the orbits are and how prominent that brow bone is. And that's what creates that brow bossing in somebody who is assigned male. You can look also at the jaw specifically. Notice how much broader it is, how much more square it looks. Whereas on the female skull at the right, you see the absence of this brow prominence, and you can see a more rounded, less wide jaw. If a person has a facial feminization surgery or the collection thereof performed, it will be common for that person to have CT imaging prior to the surgery to define their anatomy. And on this slide, I think you can see a good example of that brow prominence. Now, on the left of the slide, you can also see a depressed skull fracture, but nonetheless, you can get the idea of what we're looking at. Here are some of the common features that are modified in FFS. So first we have the brow prominence is modified. So it's going to be flattened and rounded to eliminate that brow bossing. The jaw will be narrowed and rounded. The nose is often reshaped. The hairline is rounded and advanced, or lowered, if you will. Hair transplants may be done at this time. The Adam's apple, also called the thyroid cartilage, is shaved, so it's not so prominent. A facelift may be performed to create a more youthful appearance, and also soft tissue procedures are done to modify the lip position and shape. Here's a lovely example from Dr. Spiegel's work. You can see that the patient on the left has a more prominent brow bone. On the right, that's less so. On the left, you can see that the jaw is more prominent, and it's less so after FFS is performed. Can you go to any plastic surgeon to have FFS? Well, you can, but transfacial surgeries require a special eye and a special set of skills. Changing one part of the face can throw off the rest of the face, so it must be approached as a plan for the whole face, not just a rhinoplasty or nose job or a hairline procedure. A surgeon who is expert in trans surgeries will know the various nuances of male versus female faces and how to make that transition. FFS is not easy to go through. There's a lot of swelling afterwards. Bone surgery is typically quite painful. The swelling of the nose and the airway can feel uncomfortable and can actually be quite anxiety-provoking for an individual in recovery. And certainly chewing and swallowing are difficult at first if there has been work done on the jaw. But remember, it can also make the greatest difference in a person's outward appearance. And so therefore, it is often a surgery that people find to be very worthwhile. I hope this introductory information has been helpful to you. If so, please like this video, subscribe to my channel, Transgender Medicine Made Simple, and tell your friends about it. Thanks for watching, and I'll see you in the next video.